Hey, what's up everybody? It's me, Dr. G, and welcome back to another episode of House Calls with Dr. G. Hey, I'm not in my house right now, but I'm on location at Edward Hospital in downtown Naperville. And today we're going to be talking about dementia. And I'm going to introduce you to my great colleague in a few moments. But we talk about dementia, and I'm going to be doing a show on dementia on July 10th at 4 p.m. Central Standard Time called Caring for Our Loved Ones with Dementia. But here's the deal with dementia. We have to have this conversation. It's a rising public health problem in our country. And in particular, when we think about dementia, it affects all of us. All of us at some point will be touched by our loved ones having dementia, and also people that we care for. So without further ado, I want to introduce you to my great colleague and guest, board-certified neurologist, Dr. Catherine Stachnik. She's a board-certified neurologist here at Edward-Elmhurst Health, and I want to introduce you to her. So hi, Dr. Stachnik.
Hi.
Thanks for coming out today. So
Thank
really
you.
tell us a little bit about your medical history, like where you did your medical school, where you did your training, and just what your thoughts on just dementia in general.
Okay, yeah. I'm a general neurologist. I did my training at Midwestern University and my neurology residency at University of Illinois in Chicago. And my subspecialty is neuromuscular, but I see patients with both brain conditions and peripheral nerve and spine disorders. Dementia is something that I see a lot of the time, and you know it's something we see a lot as neurologists, and it's often people being brought by their loved ones that are noticing changes.
So when you think about changes in dementia, is it more so about, obviously, you know, we think about cognitive, but is there like behavioral aspects that change too, or other kind of things that are related to dementia?
Certainly, yeah. Actually, some people can develop mood symptoms with dementia, and actually even depression and anxiety with dementia. And currently that's thought to either be a risk factor for developing cognitive decline or a manifestation as part of one of the processes that happens with cognitive decline with dementia.
So let me ask you this question, Dr. Stachnik. When we're talking about caring for people with dementia, caring for our loved ones, how do we best create more awareness that dementia is real and that the numbers are only rising in our country?
I think it's really good to start with primary care and screen for dementia,
Yeah, no, I think you're right. It's really about trying to make sure that we have more awareness, and I agree. In terms of that, a lot of some of the data that I've seen is that people don't get screened enough. Actually, I think one of the statistics from the Alzheimer's Association is that only about 16% of seniors are properly screened at a routine wellness check. So how do we kind of bridge that gap for us as practitioners to screen people better?
I think the mini mental status exam is a good bedside exam that can be done with a physician, with a primary care physician. Yeah, because right. You may not be seeing the neurologist, and that's something that can be picked up on. It's a pretty standardized thing. It's a short test. It's only a snapshot in time, but it definitely gives an idea. And just talking to patients about if they're having any change in their ability to do everyday things, like what they do, whether it's related to, being able to remember appointments or carry out everything they want to do on a daily basis.
Excellent. What's your thoughts about this, Dr. Stachnik, when I think about, we're trying to create more engagement. At the end of the day, what we do on House Calls with Dr. G, and thank you for coming out today, it's really making sure that we keep this message going. So people out there may have a loved one, a relative that may be having some memory challenges, and we want to keep that in the forefront. But let me ask you this question. Is all, so a lot of people come and see me and they'll be like, hey, Dr. G, I got some memory issues, and they go, oh my gosh, I think it's Alzheimer's. You're like, whoa, time out. Let's take a step back. So not all memory loss. What do you do for those kind of people that just say like, oh my gosh, I'm just forgetting a few things? What's your advice really to deal with that?
Yeah, no, that's when you really want to come in, because you want to be screened for some other conditions that can cause memory loss. Sleep conditions, just sleep loss itself, but sleep apnea can cause memory loss. Problems with the thyroid, and certain mood conditions.
Excellent. Well, let me ask you this. If I had to kind of say, Dr. Stachnik, give me like a few points for people that are listening to us right now on take home, just to be like, how do we continue to care? How do we continue to keep this conversation going about dementia? How do we get people to just care about it? You know, there's a lot of people that are out there taking care of their elderly parents, sacrificing their own, time, but caring for people, a lot of us just do it. But how do we make sure that people are still taking the initiative to have these kind of conversations if there is a concern about memory loss?
Well, I think, so we have still, there's a lot of research being done on dementia right now, and Alzheimer's, but I think taking a preventative approach is a very good way to approach it. Other than, awareness, going to your doctor. As far as I'm aware, there's no screenings sort of in the but there may be in the public arena. But taking a preventive approach for your your general health helps your brain health, and that includes things like exercise. We know that increases blood flow to the brain, and that decreases the risk of cognitive decline, and also staying socially engaged it carries a decreased risk of getting cognitive decline, and making sure you have good sleep.
Okay.
Getting screened for sleep disorders.
Excellent.
I think a lot of the focus is on finding the research a medication, and that's still in the works. And I think now there's a lot more focus on the early processes that go on in dementia, which is good. So we're trying to focus on catching it early, but there's still a lot to come in that area.
Well, I think you kind of summed it up perfectly, that there's still a lot out there, but there's still a lot that you can do. As Dr. Stachnik just said, if there is a concern, make sure you talk to your doctor right away. If it's a loved one or if it's yourself, but somebody, a friend, a neighbor, talk to your doctor right away. Again, there's no such thing as crying wolf when you talk about your health. We all want you to be healthy. Dr. Stachnik and I want you to continue to have a healthy, active, and just excellent lifestyle. But again, without having that conversation and making sure that you're good, it's going to be hard for us to continue to help you. So my message would be to just continue to keep that message going on and make sure that you see your doctor. So Dr. Stachnik, I want to thank you again for giving us a quick update on how to best care when we're talking about dementia. Thank you very much, and I'll catch up with you next time. Hey guys, remember, hey, you're welcome. Hey guys, remember, we're doing the show July 10th at 4 p.m. Central Standard Time on caring for our loved ones with dementia. I'll catch you guys later. Peace out.